6D taping for the canalis carpis syndrome. For the taping you will need 1 time 1 handle strip and 2 times 2 handle strips. And before you start taping, you should clean the areas where you will place the tape. And that is here in the neck area, the subclavicular fossa, venous angle, the inner side of the elbow, and of course then the canalis carpi area. And you start with the 1 handle strip. You cut from the edge of the tape just a tiny small piece of the packing paper. You release the packing paper and the small piece, and then you place the handle. Usually the handle is placed in a way that it is nice to take a good grip out of it. We put the venous angle, you can find it here above the clavicle bone, which is here. It's the most soft spot here on the neck. You have your head in a straight position, muscle relaxed, and then you place the tape here. You press it well to the skin. The adhesive reaches its maximum bond in about 15 minutes. Then you take the elbow, the inner side of the elbow. The lymphatic pathways are going through here to the venous angle. Therefore, it is recommended to tape also the elbow. You cut the tape, pull the backing paper, and it comes nicely off. The tape is stretching, but we don't use any stretch on the tape. You have the elbow bended a little bit, and you place the tape inside. You press it well from the middle towards the ends of the tape. Then we have the actual target area, the canalis carpi. You have your fingers relaxed, your wrist in a neutral position, and you place 2 handles here as well. You cut the tape from the middle, pull, release the packing paper, and place the lower handle so that it is in the scar area. Don't do any stretching on the tape so that it's so relaxed as possible. Wrist is the whole time in the neutral position. Press it well. And then you wait for the 15 minutes to start the manipulation. You start it from the venous angle for 1 minute, about 20 pulsations, manipulations, up and down from side to side, and you activate the whole arm's lymphatic system. Usually when you have a canalis carpi syndrome, there is a little bit of edema inside, and this edema we get through this lymphatic pathway here. Therefore, we activate first the venous angle here on the right side. Then we continue in the elbow. Once again, the lymph pathways go from the medial side. We actually release some space for the lymphatic flutes to go upwards. We lift up and down. We go into the actual target area. We first pump a little bit up and down. You never pull the tape so much or so hard that the handle or the tape comes off. And then with the limitation of the pain here in the canalis carpi area, you do all the 6 directions. If it's painful to go down, then go just up and other directions. But with the limitation of the pain, you can also go downwards. You do about 5 minutes here in the target area. And then when you start going up, you also press down to move the lymph first into the elbow, and you go down and down and down and down and down about 1 minute again here in the elbow, and you end up in the lymph nodes in the subclavicular fossa, and basically from here the lymph fluids will go into the blood circulation. If you want to, you can activate also the treatment by using Polar Frost cold gel. I have a roll-on here, and basically if you want to, you can also do cold treatment for the whole area. So before the taping, you can apply the cold gel into the whole area, let it cool down so that it will be totally dry, the area, and then you can place the tapes. And then also you can activate a little bit here as well. But basically the area where you have the edema, the swelling, the pain. Like this.